You're gonna look at your RISB, and I know at hospital center, they look at the RISB a couple of times to make sure the patient's not tiring throughout that 120 minutes. Okay, so the mechanics that we're looking at, the respiratory mechanics or respiratory parameters, which are the ones that we're going to be looking at and doing with the patient, like we did in the lab on Monday.
Vital capacity.
Your vital capacity, and what's normal vital capacity?
65 to 75
Mils per kg of ideal body weight.
Yeah.
And what is acceptable for a patient to be weaned?
Greater than 10 mils.
Greater than 10 mils. These are very much board questions. Greater than 10. What's the next parameter?
Minute vent.
Minute vent. What would you like to see the minute vent at?
Greater than 4 liters per minute or less than 10 mils.
Perfect. What's the next parameter?
So, 10 liters per minute.
Rugi's rolling here. Anybody else gonna help her out?
NIF.
Your NIF. NIF. Where do you want to see the NIF? What's your normal NIF?
8 to 100.
Right. Negative 80 to a negative 100. Right. And what would you like to see the patients greater than?
20.
Negative 20. Good. And the NIF looks at what? What is the NIF measuring?
Reserve pressure.
Okay, so it's breathing in. So what is it actually looking at? Inspiratory muscles. Your inspiratory muscles. Are they strong enough to take in a deep breath? Because we want to make sure the patient can cough, right? When you cough, you have to take a deep breath in. So are they strong enough to take a deep breath in? So your NIF is measuring your inspiratory muscles. What's the one that measures expiratory muscles? MEP.
Yeah,
Good. Maximal expiratory pressure. And what do you want to see that greater than?
40 centimeters.
40 centimeters of water pressure, and that measures your expiratory abdominal muscles, right? Are you strong enough to cough, an effective cough? Because you have to be able to take a deep breath in, and you have to have an effective cough. All right, so that's what you're assessing. So we did vital capacity, minute ventilation, respiratory rate, NIF, MEP, and RISB. So those are all of our lung mechanics that we've looked at. And everything looks good, right? So you've documented all that. You've documented your breath sounds. You've documented your chest x-ray. Chest x-ray is improving from bilateral infiltrates. Pleural effusions have resolved. Lysats are 100% on 40% FiO2. Okay, this is all the stuff you're documenting. Cardiovascular status is stable. Normal EKG rhythm. So you talked about oxygenation, respiratory rate, stable. Respiratory rate is 22. We talked about breath sounds, secretions, minimal, right? Because you wanted to suction your patient first to see what secretions are. Okay, you don't want them to be thick or, have an astronomical amount of secretions. They won't be able to tolerate it. They'll have to be reintubated. So you want to set your patient up for the best possible chance for being extubated and staying extubated. Right? So you're documenting all that.